You may think that I'm at the doctor's office right now, but when in fact I'm at a children's clinic at the Carthage area middle school.
School-based health cares are a kind of a mixture of a doctor's office / urgent care inside the school. We exist for the students that are registered in that school, and then they register in our clinic also. It's the low-cost, most effective model for delivering primary health care to school-age children.
Parents now don't have to leave work to get their children into a clinic. The child is able to leave on a study hall or come in after school to obtain the clinical services that they require.
There are 226 school-based health centers in all of New York State. 20% of those centers are in rural areas, just like the North Country. Carthage Area Hospital has 8 of those centers. North Country Children's Clinic has 6 of those centers, and E.J. Noble Hospital in Governor just opened one last week.
Currently in our program we have 3,500 students across 3 counties. We have clinics in Jefferson, Lewis, and St. Lawrence County. We have 3 clinics here in the Carthage Central School District. We have one in Harrisville for their whole school, their K-12 school. We have one in Edwards Knox, one in Lafargeville, one in Beaver River, and one in Gardena.
With the executive budget in New York State still under deliberation, the total money allotted to the school-based health centers is up in the air. But Joey Marie Horton, who is the co-executive director for the New York State Coalition for School-Based Health Centers, says they are very lucky.
School-based health centers have received an 11% cut within the last 2 years. However, we were very lucky to be held harmless this year in Governor Cuomo's executive budget at $21.7 million.
Terrific. I'm shocked that I wasn't aware of this before. But it goes back to the remarks I made previously. The idea of getting primary care for kids, particularly this holistic approach, I just can't think of a better way to deliver health care. And all of the problems that they solve in the community, kids not having to leave school, parents not having to come to school to bring the child outside for some kind of care. But most importantly, this holistic approach and getting primary care to kids, I think, is critical both to, again, outcomes and reducing costs.
This has been Holly Boname at the Carthage Area Middle School School-Based Children's Clinic for MyABC50.com.